Welcome back to our channel. Today we are going to highlight one of the most important vitamins for our well-being, vitamin D. One of the fat-soluble vitamins, it is also called the sunshine vitamin. In this video, we will learn about the types of vitamin D, its sources, its appropriate doses, the natural rate of vitamin D in the body, and more. Let's dive into the wonders of this bright vitamin. What is vitamin D? Vitamin D is a fat-soluble vitamin that plays an important role in various physiological processes within the human body. It is essential for maintaining healthy bones, as it helps the body absorb calcium, a mineral necessary for strong bones. Don't forget to like, subscribe, and hit the notification bell to join us. Types of vitamin D. Vitamin D2, ergocalciferol. This form of vitamin D is synthesized by plants when they are exposed to ultraviolet light. It can be found in some fortified foods and nutritional supplements. Vitamin D3, cholecalciferol. This type of vitamin D is produced in the skin when it is exposed to sunlight. It can also be obtained from some animal food sources. Sources of vitamin D. There are many sources of vitamin D between natural and unnatural sources, and it is preferable to obtain it from its natural sources. So where is vitamin D? The main sources of vitamin D. The sun. The sun is the main source of vitamin D. Adequate exposure to it daily for at least 15 minutes contributes to stimulating the production of vitamin D3, cholecalciferol, in the skin under the influence of ultraviolet radiation. Vitamin D2, ergocalciferol, is produced in plants and is found in foods fortified with vitamin D. Foods containing vitamin D. The body can manufacture sufficient amounts of vitamin D, but a person may not get enough of it if he is not sufficiently exposed to sunlight, or if the body has difficulty absorbing vitamin D, all of which leads to a deficiency in it, and the emergence of symptoms that result from that. Therefore, the body can obtain vitamin D from some foods, the most important of which are fatty fish. Good sources of vitamin D are fatty fish, such as salmon, which contains 100 grams of about 526 IU of vitamin D. Other examples of fish that contain good amounts of vitamin D include trout, mackerel, tuna, and eel. Canned tuna. Fresh fish is not the only way to get vitamin D. Vitamin D is also found in canned tuna and sardines. 100 grams of canned light tuna contains 268 international units of vitamin D, while 100 grams of canned sardines contains 193 international units. Certain types of mushrooms. Mushrooms have the ability to produce vitamin D when exposed to ultraviolet light, but there are types that are grown in the dark, and therefore do not contain vitamin D. However, some specific brands grow mushrooms under ultraviolet light to stimulate the production of vitamin D. Fortified milk. Milk does not naturally contain vitamin D, but most brands sold on the market support it. It also sometimes supports soy and rice milk to compensate for the lack of vitamin D in them. Some types of orange juice. Some types of orange juice are fortified with vitamin D. 1 cup of fortified orange juice usually contains about 100 IU of vitamin D, but the amount varies by brand. Eggs. One of the sources of vitamin D is also the egg yolk, so it is important to eat whole eggs and not just the whites, as one egg yolk contains about 37 international units of vitamin D. But it is not recommended to try to get the body's daily need of the vitamin only from eggs. Beef liver. Beef liver contains many nutrients, and 1 serving of cooked beef liver contains about 50 international units of vitamin D, in addition to vitamin A and iron. Whale liver oil. 1 tablespoon of cod liver oil contains about 1,300 international units of vitamin D, more than double the daily requirement, 600 international units per day. UV lamps. People who are at risk of vitamin D deficiency or who have symptoms of vitamin D deficiency due to poor absorption of vitamin D by the body may consider exposure to UVB lamps. But these lamps have risks such as skin diseases and skin cancer, and they also need protective glasses, so it is not preferable to use this method except with a doctor's recommendation. Nutritional supplements. Vitamin D supplements are available in the form of oral drops, syrup, vitamin D tablets, and needles for intramuscular injection. The best time to take vitamin D is from the sun. The best time to take vitamin D from the sun is during the middle of the day when the sun's rays are vertical or near vertical. Factors affecting the efficiency of vitamin D intake include the sun. Sun exposure time. Area of skin exposed to sunlight. Skin color. As the darker the skin, the slower it is to synthesize vitamin D. As for vitamin D pills, the best time to take them is after eating a main meal, as vitamin D is a fat-soluble vitamin, which means that it is better absorbed into the bloodstream when taken with or after foods rich in fat, such as avocados, nuts, full-fat dairy products, and eggs. Benefits of vitamin D. Vitamin D is one of the most important vitamins involved in the bone-building metabolism process, by facilitating the intestinal absorption of calcium, and vitamin D also contributes to the transfer of calcium from the intestine to the blood by proteins called calbindin. It also stimulates the absorption of magnesium and phosphate. In addition, vitamin D regulates the levels of calcium and phosphorus in the blood. Bones help increase calcium absorption, thus enhancing bone strength and density, preventing osteoporosis, thinning, and rickets. It should be noted that vitamin D prevents calcium deficiency and bone problems in patients with kidney failure. One of the most important benefits of vitamin D is other. Reducing digestive disorders, especially irritable bowel syndrome. Multiple sclerosis prevention. Adequate levels of vitamin D in the blood contribute to the prevention of this disease. Regulate insulin levels in the body, and reduce the risk of type 1 diabetes. Increased chances of pregnancy after insemination or artificial fertilization in women who do not suffer from vitamin D deficiency compared to those who suffer from its deficiency. Enhancing fertility in men by improving testosterone levels, as well as improving semen quality. Preserving the safety of the pregnant mother and fetus, avoiding premature birth, and preventing fetal bone deformation. Contribute to the growth of children's bones and prevent rickets. It is recommended to give vitamin D supplements to infants from birth under the supervision of a doctor, since mother's milk does not provide them with an adequate amount of it. Strengthening immunity, protecting against cancer and chronic diseases, especially in the elderly. Vitamin D also reduces the risk of immune diseases, and its deficiency is associated with an increased risk of autoimmune diseases and exposure to various diseases. Reducing the symptoms of premenstrual syndrome with calcium supplements, as vitamin D helps reduce the excess production of hormone-like substances called prostaglandins that cause pain associated with menstruation, which contributes to reducing this pain. Stimulating old hair follicles, increasing and stimulating the formation of new hair follicles, and it is also believed that there is a relationship between alopecia and vitamin D deficiency. Vitamin D dose. The recommended preventive doses of vitamin D are given in the form of a daily dose or a weekly dose, and it can be obtained from natural sources or nutritional supplements. The recommended vitamin D dose is as follows. Daily vitamin D dose. The recommended daily needs of vitamin D vary according to the age group, as follows. The daily dose of vitamin D for infants from birth to 1 year of age, a daily dose of 400 international units, taken in the form of oral drops. The daily dose of vitamin D for children after 1 year until the age of 18 years, 600 international units per day. The daily vitamin D dose for adults aged 19 to 71 years, 600 IU daily. The daily dose of vitamin D for the elderly over the age of 71 years, 800 international units per day. Vitamin D dose for pregnant women, 1000 to 400 IU daily. It should be noted that pregnancy vitamins contain vitamin D, but at a dose of 400 international units only, which is an insufficient amount. Weekly vitamin D dose. Doctors usually recommend that patients with a vitamin D deficiency take a vitamin D supplement of 50,000 IU once a week for 2 to 3 months. Increase vitamin D in the body. Taking vitamin D as a dietary supplement in high doses may lead to high levels of vitamin D in the body and the occurrence of vitamin D toxicity. Although this is rare, it is dangerous, and leads to an increase in calcium in the blood and its accumulation in the body, and the emergence of the following symptoms: lack of focus, lethargy, vertigo, depression, vomiting, constipation, hypertension, bone loss, kidney damage. Thank you for watching. If you found this video helpful, give it a like, subscribe to our channel, and hit that notification bell. Share it with your friends and family, because health is wealth.